If you're studying renal failure, maybe for an exam, or you just want to get a really solid handle on it, you have come to the right place. Today, we're going to break down these detailed study notes and turn this super complex topic into something that just clicks. Okay, let's dive right in. First, we're going to tackle the big question. What even is renal failure? Then we'll get into the two main types, a really key distinction. From there, we'll pinpoint the causes, see how the body sounds the alarm, and finally, walk through the game plan for managing the whole situation. So, let's kick things off with the big one. When we use the term renal failure, what are we actually talking about? Let's nail down that core definition. At its most basic level, renal failure is a severe interruption of what your kidneys are supposed to do. Think of your kidneys as this amazing 24/7 filtration plant for your body. Well, renal failure is what happens when that plant has a catastrophic shutdown. Suddenly, all the toxic waste that's supposed to be filtered out of your blood has nowhere to go. Now, this next part is absolutely crucial, especially if you're studying for a test. You gotta know that renal failure isn't just one thing. It really comes into two very, very different flavors. So on one side, you have acute renal failure, or ARF. Think of this like a sudden power outage. It's fast, it's dramatic, but, and this is key, it's often reversible if you can fix the problem quickly. Then on the other side, you've got chronic renal failure, CRF. This is more like a slow, steady, irreversible rust that just builds up over months or even years. And you can see this concept laid out perfectly right here in the original notes we're using. Honestly, if you can get this one fundamental difference, acute versus chronic, lodged in your brain, you're going to understand everything else we talk about so much better. It's the foundation. So let's zoom in on acute renal failure for a minute. A really helpful way to think about its causes is to imagine you're a mechanic. You're troubleshooting, and there are basically three main places where the system can break down: before the filter, inside the filter, or after the filter. First up, you've got pre-renal. The name kind of says it all, right? The problem is happening before blood even gets to the kidneys. It's like a factory grinding to a halt because the supply trucks can't get through on the highway. This can happen from something that drops your blood volume, like really bad dehydration, or if your heart just isn't pumping strong enough. Next is intrarenal or intrinsic. Intra means inside. So now the filter itself, the kidney tissue, is the part that's actually broken. This could be from direct damage, maybe a lack of oxygen, or certain toxins. It can also be caused by autoimmune diseases like lupus, where the body's own defense system gets confused and starts attacking the kidneys. It's a case of friendly fire, really. And the third fail point is post-renal. So in this case, the filter's working, the blood supply is fine, but the plumbing is blocked. Imagine a perfectly good kitchen sink with a totally clogged drain. The urine can't get out, so all that pressure backs up and starts damaging the kidneys from the other direction. Things like kidney stones or a tumor are the usual suspects here. Okay, so when one of these failures happens, what next? How does the body react? Let's get into how the body basically sounds the alarm, with signs, symptoms, and the really distinct phases of an acute failure. Now, this is a sequence that's just essential to know. ARF doesn't happen all at once. It tends to unfold in 4 phases. It kicks off with the initial phase, right after the damage happens. Then comes the oliguria phase. That's a fancy word for when urine output just tanks and all the waste starts building up. If treatment starts working, you enter the diuretic phase, where the kidneys sputter back to life. And finally, you have the long recovery phase, which can take months as the kidneys slowly heal. So let's talk about diagnosis. And maybe more importantly, let's talk about the complications. Because when a central system like the kidneys breaks down, it creates this massive, dangerous ripple effect across the entire body. The dangers here are really different depending on whether it's acute or chronic. With ARF, you're looking at sudden life or death crises, things like seizures or fluid filling up the lungs. It's like a house fire. But CRF, because it's that slow burn, it leads to these long-term systemic problems, like stubborn high blood pressure, anemia, and even bone disease as all the kidney's other little jobs start to fail over time. Now, that slow decline in chronic failure isn't just random. It's tracked in 5 very clear stages. And it's all based on a number called the GFR, which stands for glomerular filtration rate. The easiest way to think of GFR is like the processing power of your kidneys, how much blood they can clean per minute. It starts at stage 1, where there's some damage, but the power is still pretty normal, and it goes all the way down to stage 5, which is what we call end-stage renal disease. So, finally, what can we do about it? When this critical filtration system is failing, what is the action plan? Let's break down the key principles of management. The thing is, there's no single magic bullet. Management has to be a holistic approach. It's a full-court press, really. You have to support the body, try to stop any more damage, and of course, treat the underlying cause. And that means managing everything, from diet to fluids and electrolytes to constant observation and being almost obsessive about hygiene to prevent infections. So what does that look like day to day? Well, rule number 1, you have to treat whatever caused the problem to begin with. Then it's all about support. That often means restricting fluids and using a very specific diet. That high-carb, low-protein diet you see, it's actually a really clever way to give the kidneys a break from having to process all that protein waste. And even something as simple as a daily weigh-in becomes an absolutely vital tool to see if fluid is building up. It's a constant, careful balancing act. So as we finish up this explainer, I'll just leave you with this question to think about. When you really dig into how the failure of this one organ system can cause this cascade of problems, from your bones to your blood pressure to your brain, it really puts everything in perspective. It just goes to show how deeply interconnected our bodies are and why every little aspect of our daily health truly matters.